Welcome into another edition of What Barrie's Talking About from Barrie 360. I'm Dan Blakely. On this week's program, is there a doctor in the house? A couple more anyway. Recent grads of the Family Medicine Teaching Unit at RVH say they will be sticking around Simcoe County to set up practice. We learn more about that program and the difference it's making. Been a spate of lithium-ion battery fires in Toronto. These are the batteries used to charge a wide range of products from cell phones to e-bikes to lawnmowers. Hasn't been a big issue in Barrie, and the fire chief would like to keep it that way. And a local children's author is taking her book to a new level, to the beach actually. If you're a fan of Amelia's Loose Part art series, you'll want to join in the fun. Lots to talk about. We get the conversation started after this. Tens of thousands of residents in and around Barrie do not have a doctor or a primary caregiver, but the Family Medicine Teaching Unit at RVH is changing that, slowly. A couple of recent grads announcing recently they will be staying in the area to begin their careers. Dr. Stu Murdoch, a family physician in Barrie and academic lead at the teaching unit, stopped by to talk about the program and its successes with Barrie 360's Ian McLennan.
What is the Family Medicine Teaching Unit? How long has it been in existence? And why was it set up?
So the Family Medicine Teaching Unit is a residency training program that is run through the Department of Family Community Medicine, Temporary Faculty of Health, or of Medicine. And family medicine residents require 2 years of training, and we provide that entire 2 years of training through our Family Medicine Teaching Unit, our RVH, at the RVH hospital, and as well as some of the community sites. And they provide an entire residency curriculum, and that is accredited by the College of Family Physicians of Canada. And our residents write a board exam. And then after 2 years, if everything goes well, they get an independent license to practice family medicine in Canada.
Now, you hear a lot about the government, Ontario government saying, finding people a family doctor or a primary care provider. Just for people that aren't clear, what's the difference?
So in Ontario, most of the primary care is provided by family physicians. But nurse practitioners have expanded, and their scope is definitely within primary care. Many of the nurse practitioners work in teams with family physicians. So a nurse practitioner has full scope of care to provide primary care to anybody in Ontario, and they do an excellent job.
36,500 people in the Barrie area, approximately, without a family doc, primary care provider. How did we get to that point, or have the numbers always remained that consistent?
Yeah, so actually the numbers are better than they were previously. Approximately 2.5 million people in Ontario do not have a primary care provider, and in our region, it's actually down to 36,000, I think you said, and at one point it was up to 60,000. Over the years, the health, uh, uh, human resource people had anticipated this from happening, and I think the government was a little slow for the correction. But over the last few years, there's been some significant movement with regards to improving primary care in Ontario. Our government has uh, significantly expanded the number of residency spots in Ontario. At the Department of Family Community Medicine, I'm responsible for expanding 40 spots in our stream. We've added one extra spot this year at Barrie. We've opened up new teaching units in Orillia and Midland to really support this Simcoe hub. Um, and the rest of the schools in Ontario have expanded as well, all adding 20 to 40 more spots. Also, we've added a new medical school. So we have 7 medical schools with the Toronto Metropolitan University, and they hope to get up to 60 to 70 residents per year to graduate. And the government has announced the York University, and we'll wait and see where that goes. But several hundred extra spots have been added to family medicine training, which has really, really been helpful. The government's really worked hard with the primary care action team under the leadership of Dr. Jane Philpott, faculty member at the Department of Family Community Medicine, and she started the teaching unit at the Markham site. So there has been a lot of movement, and the primary care action team has really worked hard to take people off the Healthcare Connect and have been very successful in the last couple of years, but the numbers are still big, and there's still the mandate is to try to take everybody off the Healthcare Connect. There are some spots and people taking patients in our community, and really, really encourage if you need a family doctor to make sure you sign up to the Healthcare Connect. And that is the access to find a primary care provider in our community. One of our problems, though, is our primary care providers are aging, and we have about 20-25% of our population is taken care of by family physicians that are 60 years or older. So plugging the retirements has been really successful, and unfortunately, it's been hard to take more people off the list. But certainly, I would say the primary care has been in crisis, and I think we're shifting it a little from the theme of crisis to more the theme of hope, because I think we are moving in the right direction. The downside with medical education, it takes a long time to make changes in the curriculum, changes in with expansion, and it takes a long time to train a medical student and a family practice resident. Usually 6, 7, 8 years before we see the success.
And is the teaching unit, is the goal to retain those doctors once they're done their internship, so to speak, or their residency?
Yeah, I think one of the highlights of our program is that when our residents arrive July 1st, we really invite them and welcome them to be part of our medical staff, and they're really not treated like residents. They're really treated as professional colleagues. They are healthcare providers. They all have their small roster of patients that they need to take care of. They work together with our specialist colleagues, working emergency medicine and pediatrics and mental health. So they really engage and are welcomed in our medical community. Um, we are quite lucky because we have one successful, high performing hospital. We have really a large primary care community, very engaged and connected. And when they see how high functioning we are, they realize how good a place this is to practice medicine, and also living at the entrance to Muskoka. It's a great place, as we know, to learn, live, and play. Right, so.
How difficult is it to attract family doctors? You touched on the years of, work that goes into becoming a family doctor, and but why did we get to this point? We just have this shortage, and people are scrambling and going to the
Yeah.
emergency room when they should be going to a primary care provider.
Well, the health human resources is across all specialties are really struggling. We struggle to find enough emergency physicians. We really struggle to have enough anesthesia across our Simcoe County. Obstetrics has also been a challenge with recruitment. Um, so it's not just in family medicine. Obviously, family medicine takes care of a large number of people, and we do need that. Um, there were cuts in the residency programs years ago, which was a little shortcoming, and we've made a lot of the corrections over the last 2 to 3 years. And our specialist colleagues, their residency programs have expanded. But again, it takes a long time 4 or 5 years to train some of our specialty colleagues.
And do people who need a family doctor have to go on a provincial list, or can they obtain one just locally? Because the RVH sent out a note that I believe six residency members will be setting up practice locally. People ask, like, well, how can I get that
Yeah,
doctor?
some people will be able to call an office and just by luck say, we're accepting patients at that time. But the best way is to join the Healthcare Connect system where you're put on a list and family physicians that are taking new patients will be taking people off that list and inviting them to join their practice.
What does it mean for the person that doesn't have a family doctor, that consistency of care, they're going to the ER? Does it leave them vulnerable?
The kind of quarterback to your healthcare is what primary care does, and we're definitely cradle to grave. We have a massive scope of practice, and we really are the entry to the healthcare system. And these people that don't have access and entry into the healthcare system, it really, really is challenging for them because lots of times their care is a little scattered, going through emergency rooms and urgent care clinics and walk-in clinics. So they may see people at that point in time, but it's that ongoing relationship and continuous management of their health care that they need. Um, and the other big piece is that primary care has really been expanded to more team-based care, where there's more uh, um, health professionals part of the team taking care of our patients. So in our family health team, we have pharmacists and nurse practitioners and dietitians and diabetic educators, all part of the team providing primary care to in Barrie. It's about 160,000 patients are managed by our family health organization.
And if you could wave that magic wand, is there anything, one thing about primary care recruitment or retention that, in Barrie that, what would it be? What else do you need?
Well, the family medicine is complex, and there is lots of issues with anybody choosing their type of medicine. And family medicine can be challenging for people with regards to um, the scope of practice, the after hours coverage, the amount of paperwork. We know the average full time physician does around 15 hours of paperwork every day, so it's pretty challenging finding that time. Um, and setting up a small business and running the business outside of managing your patients. So having to um, deal with landlords and
And those are
leaseholds.
things the public doesn't
No.
see.
And it's really scary, and we try our very best to give some practice management skills in residency, but it's never enough until you do it. So it's always nice for our young graduates to join some of our more senior family physicians. So all of that is already set up, so they can just come in and practice medicine. But sometimes those spots are really, really limited.
Fire officials in Toronto more than a little concerned about lithium-ion batteries, about them catching fire from overheating or being used improperly. Been several such fires there recently. Haven't been an issue in Barrie, but Fire Chief Kevin White is wary nonetheless. He explains why and offers steps for using them safely. Here again, our Ian McLennan.
Chief, we're hearing a lot more about lithium ion battery fires across Canada, or at least there has been a spate of them recently, especially in Toronto, 456 in the past month or so. I'm just wondering what the situation is in Barrie. But before we begin, for people who aren't familiar, lithium ion batteries, what do they charge? Why so much focus on them?
Well, lithium ion batteries charge a myriad of things these days, from even your lawnmower to scooters, electric bicycles, and power tools that you may have around the house.
In terms of responding to such fires, is there an increase in Barrie, or what's the lay of the land?
We haven't had a remarkable increase in fires specifically around lithium ion batteries. However, we do want to always caution people to be safe.
And when one of these batteries fails, what actually happens? Like, what should the public be aware of?
Well, the overheating looks like bubbling or smoking off the unit, certainly heats up a lot. And that's something we want to be very cautious of. Once that happens, take it out of service and don't use it again.
Is it kind of like a smoldering cigarette that you discard and then it smolders? And how quickly can one of these fires go from a battery problem to something that's very serious?
Well, it can go quite quickly. That's why we say to keep an eye on them. Set a timer if you're charging them. Make sure you don't overcharge them. Certainly don't charge them overnight or on a soft surface. We want to make sure it's in a cool, dry place and that it has room for ventilation, not on something cloth.
So, like, not on a couch, not on a bed, or anything like that.
Definitely. We want to make sure we keep it on a hard surface, somewhere that it can heat up a little bit if it needs to. And we also want to make sure that you don't use aftermarket batteries. That's very important as well.
And does that be an issue? People finding something that's cheaper, but may not actually. When it works, does it not?
It works on the device that you're trying to use. However, the charging system's not made for that. It can overheat, and that can certainly cause significant issues.
Are they more dangerous fires to fight? For fire, every fire is dangerous, but is there something that's significant that stands out that makes it challenging for your crews?
Not specific to lithium ion batteries as a challenge would be. We want to make sure that you certainly don't plug something in on your means of egress so that you can still get out of your house. Of course, your fire safety plan at home escape plan will allow you to get to where you need to get to, but make sure the battery's not blocking your way out.
Can these batteries reignite even after a fire? It looks like it's been put out, or
We haven't had them reignite in our experience, but we properly get rid of them after a fire. And we caution people to do the same thing. If they have overheated, make sure they're properly disposed of, which we do have services for here in the city of Barrie.
with more e-bikes, e-scooters, they're a convenient way for people in terms of transportation. I know the Toronto Fire Chief and some have recommended that some provincial regulations are needed, maybe at the federal level or the entire fire marshal with the fire code. Is there anything that you see in there that might need changes down the road?
Well, I think in Toronto, they're specifically speaking more about dense living. And that's where we continue to build vertical here in Barrie. We want to be more cautious in large buildings where there's a large amount of people and a large amount of batteries. So we want to be cautious in those environments, but we're not sounding the alarm today. We want to make sure that people are safe and really look out for public safety.
So you're talking about the e-bikes, e-scooters, where there may be three in one apartment, two in the next, and there's just an overload, so to speak?
That's correct.
If you own an e-bike or e-scooter, you've been charging them, the same way for years. Is there anything that they need to change, or just, in terms of just their habits might need to change in terms of what they need to focus on?
That would be just it. We want you to change your habits. Make sure that you're charging in the right place. Again, not using those aftermarket batteries or chargers. And when pay attention to see if they do overheat, they start to blister or bubble. We want to make sure they're taken out of service right away.
If there's anything people could do, would you have two or three things you could really recommend to the public when it comes to these batteries for their safety and maybe the safety of the people around them?
Well, that's where you want to charge on a hard,
Right.
flat surface. Keep it in a cool, dry place. Make sure you unplug it when done. And again, I set a timer for that. Make sure you charge it for the 3 hours that's recommended, then unplug it. And then you don't have to worry about it overnight. And make sure that you inspect and replace any damaged batteries.
And that seems to be a convenience thing. It's like charging your phone overnight. Oh, it's at 20%. I'll go to bed and it'll charge and everything will be okay. Don't assume that.
Well, we don't want to assume that, and certainly not in these scooters and e-bike situations. We have to have a little more caution to those because they're larger batteries. But we do want to make sure that you don't charge your cell phone in bed with you or while you're laying on the couch. We want to make sure, again, you keep them on a hard, flat surface.
And some people do keep their e-scooters in their apartment. Their charge. Others, it's in the garage. Is there really any safe place?
There's not a specific safe place. We want to make sure that they have some ventilation and they have an opportunity to cool off. They're like any sort of motor that would heat up, and you need to give them time to cool off after use.
So is it just basically the kind of common sense toolbox fire safety that you should be practicing anyway?
I like that idea for sure. We want to use common sense. We want to follow these rules, and we all want to make sure we're safe.
This is what Barry's talking about from Barrie 360. I'm Dan Blakely, joined by Angela Odesanya, a local educator, a local author, best known, I guess, for the series Amelia's Loose Part Art. And there's two or three.
There's 3 in the series,
Yeah.
and there is 1 spin-off book, an Easter one, so 4 total.
You have a special event coming up. We'll get to that in a second, but let's just revisit what this is all about, what the books are all about, how they came about, and how you incorporate them into your everyday life teaching.
So they came about because I spent a lot of my years in education in kindergarten. I was a permanent designated early childhood educator right here with the Simcoe Muskoka Catholic District School Board. And I did a lot of loose part artwork with my students. And over some time, I felt the students were no longer using loose parts in the ways we intend. And for those who don't know what loose parts are, it's just a variety of objects with no real purpose until a child gives them a purpose. I guess the key distinction is the child has to have permission to decide how to use it. So if I am telling you you're going to use these things a certain way, they are not classified as loose parts. But if children get to follow their imagination, that is when we're using that definition. And it's really important in education. But what I was finding was kids were no longer using them. So I wanted to read a book that would model for kids um, how to approach these materials, and I couldn't find one. And then I had sort of back pocketed this idea that I wanted to write this book, which I did when I was pursuing my teaching degree. So as I was working on my Master of Teaching, I thought it was the perfect time to add to my workload and start writing my very first book.
One of them is A Day at the Beach,
Yes, that is book 2 of the series.
and that's what leads into this special event coming up this Friday.
Yes. So I am so thankful that I was able to partner with the city of Barrie on this project. It's been a long time in the works in the background, and it is finally coming to life. On the very last day of the beaches being open, I really like thinking outside the box. And so when I was writing, I always had this dream of seeing my books on a storybook walk, which is nothing new. There are storybook walks everywhere. But something I have not found in my research, anyways, is one near the beach. Usually they're on a hiking trail or something of that nature. But a day at the beach and having it at the beach, it just makes perfect sense because the story is written in a way to inspire kids to be creative at the beach. And now you can sort of just read it with your family and then go off and do it right away.
Being creative at the beach when I was a kid was just building a sandcastle or looking for shells, but there's so
Absolutely.
much more you can be doing.
Yeah, and even, the idea of building those castles and bringing in those loose parts to decorate the castles, I feel like we see that a little bit less in today's kids. What Amelia is doing in the story, though, is she's noticing little problems around her and using the loose parts to build solutions. So I think it's just inspiring kids to notice things around them, and to find a way to contribute to making society better, to making the community just to feel a part of that community.
So is the idea that you're going to look for loose parts at the park, you don't bring them with you?
Yeah, my hope is that families will be reading this story along the story walk, which is panels, right? So all the books are spaced apart, and they walk from panel to panel reading the book. And by the end, there's little prompts embedded. So there's little challenges for kids, and then at the end, there's a big challenge to go to the beach and engage in some activities, including building a sandcastle, but hopefully with a little more substance after seeing it in the book.
So this is more than just something to do on one of the last days before school starts.
Yeah, I think there's a couple great things that there's so many layers to this project. One, it's getting families outside together, enjoying literacy in a new way. Some kids who are reluctant to enjoy a book might really warm up to it in this setting. And then to see how you can use a book to launch open ended play with your kids, even at home.
Is this going to happen rain or shine?
As far as I know, I think unless it's a complete washout,
Yeah.
that might look different. But as far as I know, I've kind of checked, and last I saw 6 hours of sunlight. So let's just hope for the best.
How do people get involved? Do they have to pre-register or just show up?
You just show up. It's free. It's just at the park. It's tagging on to the city of Barrie's nature play days, which they've been running all summer. So they have a nature trailer. It's full of loose parts and lawn activities and the sort. So this is just going to be a new feature that is on their trailers, even moving forward for the next couple of years.
That's very, very cool. What time?
This event is 10 till 2, and I'll be doing author readings at 11 and 1.
All right, and it's this Friday
Yes.
at Tyndall Park.
Yes.
This is awesome. Angela, thank you so much for coming in. Thanks for the books because they're awesome. And now just extending it beyond the scope of flipping pages and reading through and learning that way. It's actually hands-on, and which is just super.
Thank you. I really hope the community will come out and show their support, and I hope they really enjoy the story.
And that's our program for this week. Thanks to Ian for his input, to Gio for pulling it all together and getting the word out, and to you for listening. If you like what you've heard, please subscribe to What Barrie's Talking About. You can also keep up with What Barrie's Talking About on Blue Sky and X at Barrie360, on our website, Barrie360.com, and there's our daily Kickstart podcast, available from any streaming service and on our website. I'm Dan Blakely. Hope you'll join us again next week.